could you please introduce yourself and tell us your background as a pharmacist?
Yes, my name is Scott Harrington. I'm a practicing pharmacist. I've been a pharmacist for 17 years. And I'm also a published author in my field. I was a primary author, here's my name, of this major pharmacology book used to train nursing students. I worked on 3 editions. And for the past 3 years, I worked as a per diem pharmacist with Target Pharmacy. And I would float and go work different shifts at different stores in Tucson, different pharmacies. I attended the University of Arizona College of Pharmacy here in Tucson, Arizona from 1993 to 1997. I earned a Doctor of Pharmacy degree, also known as a PharmD. I then completed 2 postdoctoral residencies, one at Creighton University in Omaha, Nebraska, the other one at the University of California, San Francisco Medical Center. Additionally, I served a summer internship during my school years at the National Institutes of Health in Bethesda, Maryland. Also, during my school years, I published an article in a national journal and gave a lecture at the conference of the American Society of Health System Pharmacists, the largest pharmacy conference in the world.
Okay, thank you, Scott. And I understand we're doing this video because something has happened recently at Target. Could you elaborate more on what has happened?
Yes, on Wednesday, May 21st, I was working a shift at one of the stores, the Target pharmacies in Tucson, and this mother with a baby approached my pharmacy counter. The mother was about 30 years old, and she appeared to be very ill. She was sweating profusely, her voice was quivering, and she asked me if I had a way to check her blood sugar. I did not, but she said that she was afraid that her blood sugar was very low, and that it had been as low as 40 the day before, which is a critical value. She also said that she believed that she was going to pass out and lose consciousness at any time. And out of concern for her, I told her that I felt the need to call for paramedics to come and check her blood sugar and see whatever else she might need in terms of medical care. I was concerned for her safety as well as the safety of her baby, and I let her know that.
So Scott, after you told her you were going to call the paramedics or emergency medical services, how did she respond to that?
She was reluctant, but she resigned herself to the fact that they needed to come, and she appeared to trust my clinical judgment. I told her that I was afraid that if she left the store with her baby, that she might collapse either in the store or in the parking lot, or even more dangerously, behind the wheel of her car, if she left the store in her car with her baby. And I was afraid that she might lose consciousness and have an accident, a car accident.
Okay. So Scott, you mentioned that she was reluctant when you told her you were going to call for emergency medical services, but did she eventually take comfort in that, or at least consent?
She consented, and she allowed me to escort her to a place where she could sit down in view of my work area behind the pharmacy counter and wait for the paramedics. She appeared to be somewhat confused, which is consistent with hypoglycemia. But she did. I did place the call to 911. The paramedics were on the way, and she waited for the paramedics. I offered to bring her some water. She declined drinking some water at that time, but instead she put a piece of sweet candy in her mouth in an attempt to raise her blood sugar. And she waited quietly for the paramedics to arrive. They arrived within approximately 4 minutes after the 911 call was placed.
Scott, what happened between you intervening with this lady and having her sit down and wait for emergency medical services and their arrival? What happened in between?
Very suddenly, the director of human resources for the store walked into the pharmacy, and he introduced himself to me. I had never seen him before. And he proceeded to interact with the patient and actively discourage her from having the paramedics come. And he repeated to her several times, "Look, if you don't want them to come, I can call and cancel them right now." And I chimed in. I said to him, "Wait a minute, I'm the pharmacist on duty, and I made a clinical judgment. She appears to be acutely ill. She's a mother with a baby, and I'm concerned about her safety as well as the safety of her child. She has agreed to let the paramedics examine her. She can refuse them when they arrive if she chooses, but I think it's best for her safety, best for my liability, and also best for Target's liability if the paramedics come and do what they can for her and assess her health condition.
Scott, what was the HR staff member's basis for his involvement on?
As he stated to me, he said that it was a matter of target policy that paramedics should not be called if a customer does not want them called. And he said instead that he could observe the patient himself.
Scott, did this human resource staff member state any particular medical qualifications?
No, in fact, I reminded him that I have a pharmacist's license, and that I have, which is a clinical license, and that I had made a clinical judgment call to call for help for this obviously sick patient. And he indicated that he did not have a clinical license, but again cited target policy, without specifying which policy, that paramedics should not be called if the customer didn't want us to.
Scott, did you feel at this point that you had any personal or company liability involved with this lady who frankly was not feeling well?
Very much so. I was afraid that if she did indeed lose consciousness, she could go into cardiac arrest. If she was indeed hypoglycemic, she could start having seizures, what's called status epilepticus. And I didn't have the equipment or the skills to treat her, and I didn't believe that this human resources staff member did either.
Did you think that there may have been any possibility of third parties getting involved, any bystanders that could possibly be at risk to someone?
I did. I was particularly afraid that if the woman left the store and ventured into the parking lot, that she could collapse on the parking lot with her child in the stroller, maybe be hit by a car. Another possibility I feared was that if she were able to make it to her car and drive away, that she could lose consciousness at the wheel and have an accident injuring herself, her child, and or other people on the road, or pedestrians for that matter.
Scott, can you describe the scene when the paramedics arrived?
Sure. The woman was sitting off to the right side of the front of the pharmacy on the bench, or on a chair where I had placed her. And the paramedics arrived. I checked in with them briefly and explained what I had seen, what I had just observed in my interactions with the woman. And then they began assessing her right away.
And Scott, what was their conclusion from their assessment?
They convinced the woman that she did need to go to the hospital. They were similarly afraid that she could black out if she left the store by herself, either on foot or in the car. And they convinced her to go to the hospital. They said that that was the safest course of action to further assess her condition. And so they did take her away on a stretcher.
What was your interaction with the human resources staff member after the paramedics had arrived and had taken the lady to the next higher level of care?
By that time, the human resources staff member had left the pharmacy, but instead I spoke with the store manager, the store's general manager, as well as the district pharmacist's leader, who happened to be, both of whom happened to be on the scene. And I explained to them my concerns that the human resources staff member had attempted to override my clinical judgment in making a decision to call for emergency medical services. Again, for this obviously acutely ill mother with a baby.
And then, Scott, what happened next?
They said to me that they alternated, they vacillated between saying, we support your decision to place the call, alternating with, but target policy states that we shouldn't do that if the customer doesn't want us to. And they repeated both sides of that argument several times. And I repeated my concern that I have the clinical qualifications to assess this patient, and it was within my purview to call for help, to make the determination to call for emergency medical services. I also pointed out that the human resources staff member did not apparently have a clinical license of any kind.
Okay, so Scott, what happened that night when you got off your shift?
Well, I actually booked a hotel room because I was supposed to work at the same store the next morning, and it had been a difficult day, and I live on the far opposite side of town, so I decided to spend the night in the hotel. And I filed my complaint to the executive director of the Arizona State Board of Pharmacy via email, at approximately 1:30 the next morning. So preparing that documentation kept me up for several hours later than I normally would have been on a work night.
Scott, what was your interaction with Target supervisors the following day?
Well, I was so fatigued from being kept up late, and then I had difficulty sleeping because of the stress of this incident. I decided to call out for my shift, so I called the telephone line I use that's available for all employees for sick calls, and just indicated that I didn't feel safe working in the pharmacy the next day because of lack of sleep. What I did do instead was the next morning I did forward my complaint to the State Board of Pharmacy. I forwarded a copy of that to the Target Senior Healthcare Compliance Officer in the headquarters city of Minneapolis, Minnesota. And it was later that afternoon that my employment was terminated over the phone by the Arizona level human resources leader.
And Scott, what did they base this termination on?
She said that I was terminated for 3 reasons, one of which was that I had mishandled confidential information. Didn't elaborate. I have no idea how I did that. 2, some of my interactions with other employees had been undesirable. And 3, that some customers had waited longer than necessary for their prescriptions.
Did she offer you an opportunity to state your case or form a rebuttal?
She did not. She did not. And I was caught off guard by the call. I wasn't sure what to do. I asked her if she had any additional information, which she did not, and I thanked her for the call, and we said goodbye.
What are you hoping to accomplish from sharing your story?
I hope to give all pharmacy patients an honest and open appraisal of the very real risks and hazards that are present anytime they visit any pharmacy. I also want to empower all pharmacy patients, as well as all pharmacists and pharmacy technicians, to hold their employers fully responsible for providing state-of-the-art equipment, including pharmacy computer software, appropriate staffing levels, and extensive staff education and training that is commensurate with the level of risk involved in performing their daily jobs. All of the things that I have just mentioned are fully necessary to provide quality pharmacy services and to protect patient safety at the highest level possible. My name is Scott Harrington, and I am a practicing pharmacist.